Hi, my name is Jamaica Mallory, and this is How to Write a Birth Plan. And I am going to guide you all through what to expect for birth here with us at Wayne, what your options are, how to know you're in labor, how to write a good birth plan, how to communicate that information to people. Do you even need a birth plan? Like, what are the benefits, the pros, cons, and things like that. So, to get started, like I said, my name is Jamaica Mallory. I am a nurse midwife. I am also a women's health nurse practitioner. I'm an international board certified lactation consultant and a Lamaze certified childbirth educator, which I know is a lot. It really just means I'm very dedicated to helping people such as yourself and your family have really good outcomes. I'm a mom of three boys, and I've been working in women's health since 2006. I am originally from Knoxville, Tennessee, and I've been in Goldsboro for 7 years. This was Melissa, who also helps me sometimes teach this course. So, Wayne Women's Clinic has been in this community for greater than 50 years. Our practice is currently 11 providers. So we have six physicians that work with us, one who stays in the office only. We have four nurse midwives and one physician assistant. Our physicians are Dr. Waddy, Dr. Welsh, and then Dr. Hudson Fraley. We also have Dr. Adekoya and Dr. Spisak. The nurse midwives are Benjamin, me, again, Jamaica. We have Jenny and then also Melissa. Our GYN only providers are Caitlin Rhodes, who's our PA, and then Dr. Lees, who had a lot of people say delivered them when they were a baby. So Dr. Lees is semi-retired. So what is the difference between a physician and a nurse midwife? So physicians are trained surgeons. In our practice, they see patients in the office. They do GYN patients and OB patients. They also help with doing surgery. So up on labor and delivery, most of the time, our physicians are assisting with doing assisted vaginal delivery, such as forceps or vacuum, and doing C-sections. When they're on call, they're also covering for the emergency room. They do sometimes attend normal vaginal births. So if you had a physician that you really wanted to work with and they were able to do that, considering that they have to cover multiple places, sometimes they don't have the flexibility to that. They can work with you then. They also work with doing the normal vaginal births. And the certified nurse midwives, we're different than physicians because we are mastered prepared registered nurses. We have training specifically geared towards supporting normal vaginal birth. And that is what we specialize in. So our approaches to birth and to labor and how we support families are a little bit different. Historically, physicians manage conditions and they view things as things that need to be kind of more controlled. Whereas nurse midwives believe that labor is physiologically normal. So that means that we don't think that it's something that needs to be managed and that we want to help to support it in being as normal as possible. Since nurse midwives came to Wayne, the C-section rate has dropped tremendously. So when I first started here, it was almost 40%. And now it's in the teens. And it's really because of bringing this model of care where you really view birth as this very normal life process. So it's our job as midwives to recognize the normalcy and to protect the normalcy of labor, and then identify when something has deviated from the path of normal, and then to support you in getting back to the path of normal, and then recognize if it doesn't appear that it's going to remain on that path, and identify if vaginal birth is the safest way for you to birth your baby. Most of the time, you will be with your nurse midwife, and then we will be the people that are with you from when you're admitted until you give birth. And then after, sometimes the physicians are partially a part of your care. They might be part of like making like a plan, like, well, if things are going this way, then, we might need to intervene. So you might be here and not see a physician at all. So who delivers the baby? The truth is that you deliver the baby. So we are all a team here that work for you, that are supporting you. So you're going to do all of the hard work. Your nurse is going to be the person who's there with you at the bedside. They're going to be coming in and making sure your vital signs are good, making sure that your baby looks well, like implementing any interventions that we've all agreed on. Your support people, so if it's your mom, if it's your best friend, if it's your partner, they are with you at the bedside, hopefully providing you with lots of good energy and support, and encouraging you in this amazing thing that your body is doing. The midwife will be there to assist you with the birth and with the support and management to help things to go well, and also to help you in the birthing of your baby, and to provide any kind of control for bleeding afterwards and doing repairs if any are necessary. And the physician is in-house should their assistance be necessary. So now we're going to talk a little bit about how to tell if you are in labor. So with this picture, you see cervical effacement, which is what it says really big. Everybody thinks about like how many centimeters dilated are you? Dilation is just one measurement of how your body is progressing towards labor. And believe it or not, we don't know why people go into labor or how. We don't know if it's a shift in chemicals in the baby, if it's like a maturity in the baby's lungs that release something that tells your body to do it. We don't know if you get this rush of hormone that makes your cervix softer. We don't know why people go into labor. We know that most people will go into labor between 38 and 42 weeks. I promise we won't make you go to 42. Sometimes people want to, and we will support you in that process as well. But normal labor usually starts between 38 and 42 weeks. And it's from this complex interplay of all these hormones in your body and your body's response to baby and all of the good stuff. So in this, we see the very first picture. Here's the baby's head. Here is your cervix, which is this long kind of meaty tube that is inside. And we say that your uterus is one organ with two different types of muscles. I'm drawing a quick picture. So similar to what you're seeing right there. Give it to me. Oh, I'm too blurry. You're not going to be able to see it. There we go. So your cervix is attached to your uterus. That's the thing that's getting all big. And then there's your baby on the inside. If it'll do it, it's so blurry. But the muscles of your uterus are contractile muscles. So that means that they squeeze, they reshape and squeeze and get really big at the top so that they can push the baby down and out. Your cervix, though, is made out of smooth muscle. So it's a different kind of tissue. And its job is to hold things tight until it's had like all of these responses that it's time to be softer. And then it will release, become stretchier. And then that will allow the baby to come out. So that's important because when you are, especially towards the end of your pregnancy, you're going to start to feel lots of different things. Like you might start to feel crampy. A lot of times that is that lower part of the uterus getting softer so that the baby can engage. But your contractions actually start at the top of your tummy. So you can place your fingers into your belly and it should normally feel soft. But when you're having a contraction, you'll feel that it'll feel firm and it'll stay like that, usually for about 60 seconds. And then that will release and improve that. Hi. All right. So your cervix, when it's not effaced or dilated, is firm and it kind of feels, let me say like a little hot dog. If you've ever felt it before, if you were like, and I like trying to get a tampon out or something like that, if you put your finger into your vagina before you were pregnant, you'd feel this like hard bumpy thing that's in the back. So that is your cervix. As your cervix starts to change, as delivery becomes closer, the muscles, like I said, in the cervix will start to get really stretchy. So your cervix will start to become thinner. So that's what the percentage number will be the effacement, like how thin it is. So in this example, the cervix is 50% effaced and it's not really open yet. The next one over the cervix is 100% effaced and is dilated. So the dilation, especially for first-time parents, is usually the last thing that occurs. And for people who have had babies before, your cervix can be dilated and it not be that you're about to go into labor. And that can be true even if you are pregnant for the first time. So dilation by itself doesn't count. Um, Effacement by itself doesn't count. Labor is contractions plus dilation. So those things going together. So cervical change plus contractions equals labor. So if you're 3 centimeters dilated and you're like, oh my gosh, any day now. And then we wait a period of time, we wait a couple of hours, we check again, and you're still 3 centimeters dilated, you're not in labor. So as the cervix continues to change, the baby's head will also start to come down. That is called engagement. Sorry, I had brain fart. So that is called engagement. So when we check your cervix, we'll be feeling for how soft your cervix is, what position it's in, if it's still firm and pointing towards your butt, which helps to protect the baby, which means it's definitely not getting ready to come out. Is it like soft and sweeping towards the front of your vagina, so it's easier for the head to come out? So we'll feel for that. We'll feel for how soft it is. We'll feel how open it is, and then how far down the baby's head is into your pelvis. So people ask, when are you going to check my cervix? There are really 4 times to check a cervix. The first one, and it always matters, is because you want us to. So it's your body. We work for you. We'll do what you need. But the other times why a provider would recommend your cervix be checked would be if you think you're in labor. So you think you're in labor, and we are using that information to establish if you are in labor or not. Labor is typically 5 to 6 centimeters dilated plus regular contractions. So we use that gauge because we know that if you are around 5 or 6 centimeters dilated, the chances of things like stopping all of a sudden are almost zero. So that helps to keep us from starting unnecessary interventions with you. So we think that you're in labor, we're establishing that you are in labor. The next one is that we know that you're in labor and we're making sure that labor is progressing normally. Now, like as a group, we don't tend to, the midwives don't check you every couple of hours. That's something that sometimes the physicians are like, you're supposed to check every 2 to 4 hours. What we find is that checking repeatedly can increase your chances for infection. So if we know that labor is doing its thing, we're going to wait for you to like show us signs that you are having change. And then we're happy to evaluate you. We're also happy to evaluate you if you're like, okay, it's been a minute. Can we check and see what's going on? The last one is if we are going to put you in labor. So if you were going to have an induction, you came up here to start an induction process, we would check your cervix on arrival, obviously with your permission, and then would formulate a plan of if we need to do cervical ripening, which is a process of helping your cervix to be soft, like I was saying, like it's soft and stretchy so that the contractions would be more effective, or if your cervix was already really soft and stretchy, and then you just needed the addition of the Pitocin to help you have more regular contractions. So what do contractions feel like? Contractions are waves. So it's this impulse wave where you have the space in between where the muscle is relaxed. You'll feel as it starts to build up. So you'll feel this increasing tension inside. You'll have a peak, and then you'll feel as that peak starts to release. And then usually, again, a few minutes in between. So when you're timing your contractions, you want to start from the start of one when you can start to feel that energy start to build up until the start of the next one. So that will tell us how frequently your contractions are coming. Contractions that are going to make the baby come are going to come in a really regular pattern. And that's super important. If you've been out and shopping and walking around and doing stuff like that, and then you start having like these kind of irregular contractions, totally normal. They might even be uncomfortable, kind of depending on your comfort level. So that is really normal. So those would be the Braxton Hicks contractions. If they get better with rest, if they get better with hydration, those are all signs that it's not labor contractions. So labor contractions increase in intensity, and they get to a point where I know in my personal experience, and what we always tell people is that you couldn't walk or talk during them. I've had people be like, oh, I could walk and talk through mine. I'm like, you are obviously more hardcore than I am. but that definitely was the sign. A contraction will stop you in your tracks. And that's because that process is something that your body knows how to do. You know how to have a baby, even if you've never had one before, just like you know how to poop. You don't need anybody to tell you how to do it. And that's always hard, I know, because like I know that there's one thing that like women, pregnant people are scared of, it's pooping. And like you're talking about labor and talking about pooping, but um the process of pushing your baby out is a reflex. It's a very normal thing that your body just does. Just like you don't really need to be told how to throw up. Your body will throw up if it needs to throw up. You don't have to be told how to poop. If you need to poop, you can sense that you're going to have to. Usually you can kind of tell like, ooh, my stomach kind of feels kind of swimmy, and then you do it. You will have those same kinds of symptoms, but they're different, obviously, because they're related to labor. And thankfully, it usually isn't like from 0 to 60. Like it is like I'm starting to feel this discomfort, and then it goes away. And it might be very mild in the beginning. And they're usually kind of further apart in the beginning. So it's easy to be like, what is this? Am I having contractions? I can't really tell. And when they get to that nice regular wave pattern, usually every 5 minutes, they last for a minute and it stays on like that for 1 hour. Didn't get better even though you got into a warm bath or you drank some water. Maybe you went for a little walk to see if you can kind of shake it off, or you took a rest. None of that changes it. That's a good sign that you might be in labor and come to see us. Will my water break? Usually not. But sometimes so. Like a lot of times, on TV, everybody's water breaks. Everybody's like walking around the store and then, oh my God, my water just broke. That is not always what happens. For most people, the sign that they are in labor is that they will have the contractions. But water breaks spontaneously about 20% of the time. Sometimes your water will break and you're in labor. Sometimes your water will break and you're not yet in labor. The things to know with the water is that it will not do it once. That it's a little trickier if you just got out of the bathtub or shower. People will be like, I was just in the tub and then I stood up and then there was water and I didn't know what it was. And I think that's a really common way to kind of feel. And we don't normally like put a lot of water in our vaginas while you're in the tub, but the great rule of thumb, put on a pad, walk around. If that pad is full of water in an hour, your water's broken. And come and see us. You might have your water break, and if it has a bad color to it, like if it's a greenish color, or if it has a foul smell to it, or if you see something else come out, then those would all be reasons that you'd want to come to the hospital. If your water bag breaks, you don't have a bad smell, it's clear, and you live relatively close by, and you wanted to, like in your group B strep swab was negative, and you wanted to take a shower or stay home for a little bit, that is acceptable. And you could wait for contractions to get a little bit closer together. If you come and see us, we can verify that your water is broken. And then, what I want you to feel for us is that like, just because you're here doesn't mean that we have to do anything. We don't have to do anything right now. And you'll see when I get to it, but you are the boss. We work for you. So if your water just broke an hour or so ago and you came right in because you were like, I'm not really sure what I need to do. But you want to give it a little time to see if labor starts on its own, like that's very acceptable. And we really want to support you in your plan. So the big warning things we want you looking out for are, again, is your water broken? And then are you having those contractions, but also bleeding? Spotting is not uncommon, especially if you had a cervical check or sweep recently. You might see some bleeding. That's not uncommon. But if it's heavier than a period, that is abnormal at any point. So please come in so we can evaluate you. If you're not feeling good movements for the baby, you're not getting those 10 movements in a 2-hour period, we want to see you. Also, if you're not having that, eat or drink something, see if the baby perks up. If you're still not feeling it after 1 hour, you're not getting good movement, we need to see you right away. You can always call and you can always be seen. There are no dumb questions. You are your baby's advocate. This is your child. This is your life. Advocate for yourself. Come and see us, and let's make sure that everything is okay. People are like, oh my gosh, I don't want to go in, and then like everything's fine. Like, that's great. Like, I love that you came in and everything is fine. We want that. Obviously, it's ideal that you came in and you were actually in labor and you get to have your baby now. But if you come in and it's not time yet, that's okay too. If you're worried about movements for the baby and we say, look, your baby's okay, that is worth $1 million. It is so like reassurance is so good and important. So please come and get that if you need it. When it comes to who you call, there's not really a wrong answer. You can call the office 24 hours a day, 7 days a week, even on holidays. The answering service will page the doctor that is on call, and then the doctor on call will call you back. If you are watching this and you're a Wayne County Health Department patient, you can call their office, even like during business hours, and they should be able to see you for walk-in. We can see you at the office for a walk-in. You can also call labor and delivery if you have questions, and if the midwife is available, we will answer those questions for you. But you also can just show up. Like, you don't need anybody's permission to come to the hospital. If you think something is wrong, or you're concerned, or you want to be evaluated, or if you spoke with a provider and you're like, I don't really like that answer, come in, come and see us. We are always happy to evaluate you and make sure that things are okay. So what if you don't go into labor? So it's 41 weeks maybe, and you've not gone into labor yet. What happens? Then you would be induced. Inductions are where we have you come in, we evaluate you, we make a plan to help you to go into labor naturally. Sometimes people are induced earlier than 41 weeks. If you have medical problems like high blood pressure, we're concerned about the growth of the baby, you have diabetes or other kinds of medical things. If you are like military and you have other kids and people are coming in to help to watch them and you don't have any family that's here, so complex life situations, or, we're able to accommodate elective inductions, which sometimes we're able to do, which is kind of, I'm at least 39 weeks and I really don't want to be pregnant anymore. Sometimes we can do that. We can help you out with that too. You would come into the hospital and do that. So inductions do not have to be the end of birth planning. It doesn't have to be, well, if I'm induced, now I can't have the birth that I wanted, because our goal is really just to get you into labor. So I'll have people say that, like, I don't want Pitocin because I know that the contractions are going to be way worse with Pitocin than without it. And I say, it's not just about me, but I've had 3 kids. My first one I was induced, and the other 2 I went into labor naturally. None of them felt great. I think that labor is just one of these experiences that when there's a lot of anxiety around it, you want to try to have as much control as humanly possible on making it like the least painful option. I think a lot of that has to do with our messaging around what labor is and how people experience it. I think that labor is not the most awful, worst pain you will ever experience in your life. That's a personal opinion, but I think that we have to kind of reframe how we look at birth, how we look at labor, how we look at what our bodies are capable of. So when you have other sorts of injuries or incidents or times when you might have connection with the medical system. So let's say you like broke something. If you broke a bone, you would have the initial injury. And then your body starts to release all of these hormones that help you to kind of cope with some of that discomfort. Labor, your body does the same thing. If you stub your toe, it hurts until the pain goes away. When you're in labor, you have contractions, which your body can tell you're building up to one. You have the peak of it, and then you have where it releases, and then you have minutes in between where you're not in that contraction state. So it's very different because it's not like you get hurt and then you just hurt for a long, long time. You have the contraction that you manage, and then you have the space that is in between. I think other conditions, like if you've ever had dental pain, Dental pain is awful because like you can't like breathe in your mouth. Like you can't drink stuff that's different temperatures. Like your face might hurt and throb, and you are in pain until you go to the dentist or until you get antibiotics or until you do whatever. So labor is manageable in that you just have to do one contraction at a time. Your mileage may vary, but I think that having that kind of a view of it, of I just have to do these one at a time, makes a really big difference. But in the process of induction, we identify if your cervix needs to be softer or if your cervix is already soft and you just need Pitocin. We use a couple of different things to help the cervix to be softer here. We use a Cook's catheter, which is a double cathetered balloon that goes into your cervix. It inflates with water. You still pee and poop the same way because it just kind of goes near the baby's head. And then another balloon that anchors it into the vagina. Those things work together to help your cervix to be softer. So we do that and usually start some medicine to either help that cervix to really get soft. That would be Cytotec or Pitocin. Cytotec and Pitocin are both man-made versions of hormones that your body naturally makes that help with the labor process. Whenever you're receiving those medications, we want to make sure that you're tolerating it well and that the baby is tolerating it well. So we do want you to be monitored at those times. But the best part about them is we have either reversal agents or we can turn them off. So if you're in a really good pattern and things are changing and you're really close and it doesn't seem like you need the Pitocin anymore and your body's going to take it over, we can turn it off. We can turn it down. We can adjust it. It is not our goal to make you blow your baby out as fast as humanly possible. It's our goal to help you have your baby. So when you get to the hospital, you'll enter through the emergency room. We want you to go through that point. They will call. You don't have to sit down in the emergency room. They'll call, let us know that you're coming up. We'll get the things ready. You'll come to the room, like one of the people from the emergency room will bring you upstairs. You'll be weighed as soon as you get here. A nurse will take you to the room and will ask you questions about what brought you here today. They will then let the provider know that you are here, and then we will come out and talk to you a little bit more to figure out what your concerns are, and usually with your permission, again, evaluate your cervix, and kind of look at it together, and we would make a plan together. So that plan really, it kind of depends on what's going on with you. So that plan might be that, holy cow, yeah, for sure, you're definitely in labor. Let's get you admitted. Let's get that stuff rolling. It might be that you're not in labor yet, but you definitely seem uncomfortable. Let's hold on to you for a little bit, and then we can recheck in a few hours to see if you've had change. For people, especially if they've been very uncomfortable and they haven't gotten rest, we might offer you IV fluids or pain medicine so you can get a nap. That's what we call therapeutic rest. And it might also be, your contractions are quite far apart and your cervix is closed. It doesn't appear that you are in labor at this time. And then having you go home where you might labor more comfortably. COVID seems to be less of a concern overall, but I still want to hit on the policies related to that, as it has affected lots of things. So our current policy for visitors is 2 visitors. If you have a registered doula or a certified doula that's working with you, that doula does not count as one of your support people. So you could have 3 people in the room if one of them is a doula. You do not have to wear a mask. And you don't have to be tested for COVID any longer. If you had a baby with us during the COVID times, it's very, very different. This things were all kind of wild during the COVID times. But you don't have to have that, the testing, you don't have to wear a mask. Your guest can change out as of today. We typically prefer over on this side that you keep your visitors like the same kind of people, so it's not a lot of flow of people in and out. When you transfer over to the postpartum side, or what we call women and infant, the visitor policy is a lot more lax. I liked this picture because she seems very uncertain, but it also kind of makes me feel a little bit anxious, like she looks anxious. And that might be what your response is when you get here too. You are going to obviously, if this is your first baby, you're doing something you've never done it before, it would be pretty common to feel nervous about that, even if you're super excited. So having that combination of feelings of I'm really excited about having the baby, but I'm really nervous because I don't know what to expect. All of that is normal. So now you're here, we know you're in labor. What is the plan? Who is the boss? You are the boss. And this was the only thing that came up when I typed in the word you. And if you like the show you, we have that in common. We can talk about it. But truly, you are the boss. So we, no matter what anybody tells you, no matter what anybody thinks, no matter even what you think, because you might be like, I just trust you guys completely. I don't want to ask any questions. I just, whatever you guys say, that's an okay way to be. But you are still the one that's in charge. So you're going to be the one that decides whether it's okay for us to check your cervix or not. You're going to be the one who decides what medications you're comfortable receiving and what you're not. You're going to be the one that tells us what you need. We will be asking you questions to help to support you along because we kind of know what to expect. But that doesn't mean that we are the ones that ultimately make all of the decisions or have all of the power in the situation. You have the power. I want to do a quick list of the options at Wayne. Sometimes I'm in a lot of like birthing groups and stuff, and I'll see people be like, you should go have your baby at this other hospital because they have squat bars. And I'm like, do people not know we have squat bars? So I'm going to tell you some of the quick things before we get into more of the other things. Our hospital has birthing balls, squat bars, intermittent monitoring, which is where you don't have to stay on the monitor the entire time for low risk patients where we're not giving you medicine and stuff. You can birth in any position that you like. Jamika, has one personal request, which is that you don't birth on the floor, just because my back is quite bad. So if you would not birth on the floor, that would be ideal for me, but I would still come to you if that's where you needed to be. You can eat and drink in you can eat and drink in labor. You can play music. We will offer you massage and different kinds of positioning. So we might help you to get on hands and knees, especially if you're having a lot of back labor, and help you with working the baby down. You can have a doula, you can have a birth photographer. There are some restrictions for the hospital as far as doing video of the delivery itself, or taking pictures of people who have requested not to have their photos taken. So we ask that people be respectful of that, but you can definitely do that. And it is our standard protocol to delay the bath for the baby. Our hospital is unique. We're one of the few hospitals in this area that offer nitrous oxide or laughing gas. We have peanut balls, which you might have heard of on your TikTok and stuff. They work amazingly in helping to open the pelvis and allowing babies to come out. Should you have a planned C-section, we do offer like gentle cesarean. All of our C-sections are done with clear drapes. So like a drape where you have the option to kind of see the baby be born should you want that. When you're birthing with us vaginally, we are very proud of the fact we have a low rate of severe laceration. So most people, if you even tear at all during your birth, are very, very minor. And it's because all of the midwives use this mineral oil compress counter pressure, helping you to push during times where there's not as much pressure there, really guiding you and supporting you in that process. We do have the Jada hemorrhage kit, which a lot of people have asked about because of the nurse that's on TikTok, and I can't remember her name right now, but she's made it super popular. We have those too. You can have, you don't have to have IV fluids running continuously, especially if you're eating and drinking during labor. So that is, we want you to be reassured of that. We do love for you to have IV access though. So that would be where we place an IV, but that there wasn't a tube and fluid and you weren't connected, you could get up and move around. You can get into the shower during your labor process if you are a water baby like me, and being in the water helps you to feel more comfortable. You could probably birth in the shower if you wanted to, but again, it's kind of a small space. You'll see them when we do the tour. We all do immediate skin to skin. We do delayed cord clamping. That's all standard stuff. You don't even have to ask about it. You don't even have to put any of these things on your birth plan unless you wanted to, which would be very okay too, because these are all of the things that all of us do. We are all super into birth. We are all birth junkies. We want you to have all of the things that you need, that you want, that will help you to have a great birth experience. So this was developed kind of to mirror Maslow's hierarchy of needs. And it's called the birth hierarchy of needs. So there was this saying that would go around that would be like healthy mom, healthy baby. Well, we think that healthy mom, healthy baby is where the base, like that should be the minimum standard of what it is that we're doing. With this, they're like everybody is alive. Alive is the base minimum, which means you have access to life-saving care should that stuff be necessary. So we do that for you by all of us being trained in how to help you and to help your baby. We have a nursery available, we've got supplies, we do drills, so we are prepared to help you guys to get through this experience. Healthy mom, healthy baby, of course, that is what everyone's goal is going to be, that everybody is born safe and healthy. But there's so much more that goes into having a great birth. So that's going to include things like you had a trusting environment, like you didn't feel coerced, that no means no, that nobody is telling you to do stuff that's not necessary, that our care for you is evidence-based and it's up to date with good research, and we're not like doing things like routine episiotomies or stuff like that, or doing C-sections for no good reason. We really want you to trust the team of people that are taking care of you. Autonomy is like that you felt respected, that you were involved in your care, that your care was empowering. Sometimes it's hard to imagine that your birth could be an empowering experience. My hope for you is that it will be, okay? Because you are going to see just how powerful your partner is, how powerful you are, how amazing you are in all of this. So we definitely believe in you, okay? Then the next thing is that you were heard. So even when complex things arise, that you felt accepted, that you were included in decisions, that you felt connected, and that you have access to good resources. So all of those things should be true. Okay. So a birth plan is a guide. That guide should be reflective of your informed decision-making process. You guys as a family sat down and talked about what things were important, what you wanted from this experience, what would make the birth feel good. And sometimes people are like, well, nothing would make the birth feel good, right? Because it's birth, and so it's supposed to be awful. And I'm hoping that we're reframing that, right? We're changing the way that we're looking at birth, and we're knowing that birth is going to be empowering, it's going to be good, we're going to have good support, all of those things. And people will say, well, there's nothing that I can control. There is a ton of things that you can control about your experience that are not necessarily just how you're giving birth. So you can control things like the environment. So I want the lights to be dim because that helps me to feel more connected and soft. I want the noise to be low. I don't want there being unnecessary chatter in the room. I don't want certain kinds of procedures done for myself or for my baby. I want my support person to cut the cord. I want to take my placenta home. I want to breastfeed exclusively, and I don't want my baby to be offered formula. All of those are things that can very reasonably be included in your birth plan. And so don't be afraid to include them. So people will say anything can happen, and it sounds really crazy, but not anything can happen. You are going to birth your baby, period, right? So can anything happen? No, you are going to birth your baby. You might birth your baby vaginally. You might birth your baby by C-section. Your baby might need additional support after they're born. You might have some concerns with bleeding or have a tear or things like that. But the amount of anything is pretty contained. And why am I saying it like that? Because I'm a midwife. And what do midwives believe? We know and believe that birth is normal. And we also believe that birth planning is not bad luck. It doesn't curse your birth. You still can have a really great and powerful and empowering experience from that. But birth plans, for to be really effective, need to just be a guide, like base kind of what kinds of things do I like? What kinds of things have I read about? What do I have questions about? What do I have concerns about? And they should be fluid. They should be fluid and adaptable. They have guide markers, and they should reflect where it is that you're giving birth. So if you came and you're like, I am here and I'm ready for my water birth, we would be like, snap, I'm so sorry. Unfortunately, we don't offer water birth. We do have the shower though. So for you, that might make or break your birth experience, but hopefully you've spoken with people ahead of time. You are kind of prepared for what options are available or not. Sometimes people will be like, I am 100% getting an epidural. I refuse to have a baby without it. And then you might come in like ripping and roaring and you're already giving birth because you did such a great job at home. And we check and say, it's just time to have the baby. And that might be the most devastating thing ever for you. Hopefully it will not be. Hopefully we will like pour all of our love into you and you will see again how amazing and capable your body is. But sometimes that can be challenging when you had your mind on one plan and then you had to go a different way. Another kind of flip of it is that you might have said, I do not want an epidural no matter what. I know I'm going to do this and I don't need one. And then you end up feeling like that's going to improve your experience. So my statement on that is birth is an intense experience. It should not be suffering. If you have used all of your wonderful coping mechanisms up to that point, and you have now tipped into suffering, we need to do something about it. We need to change it. Whether that thing that we do is change position, if it's fluids, if it's IV medication, if it's nitrous oxide, if it's an epidural, whatever it is that you need so that you can be present and engaged and happy in this experience, we need for those things to be present. Okay. So unmedicated births are phenomenal. They're beautiful. They're super exciting and amazing, but birth is really amazing. And I've seen gorgeous births that were done with epidural. So don't feel like it would cheapen your experience. So what makes a great birth plan? A great birth plan is one that you guys have talked about ahead of time. You've done your research, you know your options, you know what the things are on there. You're not just checking boxes and being like, I'm not really sure what this is, but like it seems okay. And then when there's stuff that's on there, that's the big stuff. Ideally, we've gotten to all have a conversation about those things ahead of time. So, for example, vitamin K is a vitamin that's given to babies because their blood doesn't clot very well. So because it doesn't clot very well, the chances of them having a more severe bleed can be a little higher. Vitamin K levels do tend to increase over the first week of life, but by giving vitamin K injections shortly after birth, you can decrease the chances of babies having a bleed in some other part of their body. So especially if they had a difficult birth and their heads got smushed, blood around the brain can be an issue. If your baby were to have a circumcision, the chances of that area bleeding and not clotting off very well are higher. So our pediatricians won't do a circumcision on a baby that hasn't had the vitamin K. Sometimes people will say they don't want the baby to have vitamin K because they don't want their baby to have any vaccines. Vitamin K is not a vaccine, it's a vitamin. But there's lots of reasons why people choose some things over other things. Like you might choose not to have your child circumcised, or you choose for them to be circumcised. Fun fact, that's your kid. You are the one who gets to decide what you want, what you don't want. So it's completely up to you. You are the one who's in control. That said, you are in control, but that doesn't mean that your baby doesn't have potential risks or whatnot associated with those things. So when that happens, those are moments where you guys as a family have ideally already looked at these things, looked at the options, looked at why, and you just have to remember your why. Why is it that you chose that you wanted to do this or you didn't want to do it? Why is it important? So why should you have a birth plan? Because birth is important. If you were a runner and you were going to have knee surgery, you'd go to the doctor and you'd be like, okay, doc, I know that I have to have this knee surgery, but I love running and I want to make sure that I can run. What is my plan? And they would say, okay, well, we're going to do this, but by this day, you should be able to do this. By this day, you'll have this, you'll have access to that. We'll make sure you've got good mobility. We'll have this plan. And you talk about all of the things because it matters to you. Because of how society has been around birth, there's this assumption that birth is like the worst, most painful, most awful thing that you will ever experience in your life. That's how we talk about birth. That's how we treat people when they're birthing. And people act like there's no way you are going to be able to do it. So if you look at birth for the last 100 years or so, we moved from people giving birth largely in their homes with community midwives to the boom of the hospital movement, where there was a lot of emphasis on the medicalization of really everything, including birth, and births moved into hospital settings with the increased access to pharmacology and to these physicians that were, for the first time in history, really becoming like a legitimate profession. Um, the assumption was more physician control improved outcomes. So that if your doctor was the one who was in control of all of it and you didn't have to do anything, that the chances of something bad happening were less. That obviously moved us a very different direction from you being in your home and doing it with somebody who'd had a lot of experience and helping people have their babies at their homes and things like that. Infection rates, were a huge deal. They are still a huge deal, but when you're in a hospital setting, you can see things like things from the 50s on how to sanitize you as a person, where like they're telling you to like do douching with Lysol. This was sponsored by Lysol. We had the increase in formula, which, was of course subsidized by the government and by formula companies. We had a lot of things shift. And people who are guiding how you might think about birth are people who lived through those experiences. So, like my mother was born in the 50s, as I'm probably a lot older than most of you. My mom was born in the 50s. I was born in the 80s. Her mom, I don't remember how old she was, but in the 30s or something, when she was born. So she might have been the first one in her family to be born in a hospital. And more than likely, my mom was the first one to be born in a hospital and not my grandma. But that's for lots of other complex reasons. So when we were looking at births in the 40s and 50s, those were people and times when people were using things like twilight birth, where there was anesthesia and people were being knocked out completely. And there was an increased use of like forceps deliveries, more severe lacerations for people, things like that. Birth has obviously changed. We've had this like movement away from medicalization, more towards the support of the normal birthing process, because number one, being completely knocked out, not remembering your birth made a lot of people feel really sad about their birth experience. But we had Lamaze come onto the scene. People started to feel more empowered. People really wanted to feel connected to their experiences and to their births. And people started to say, maybe all of this stuff that we're doing is not great. So we had all of this super medicalization, super high control, and then you see this really high number of C-sections, where there are hospitals in our country where the C-section rate is 50%. 50% of all of the people that go to the hospital end up having a C-section. That's insane, right? So we want to give you guys the best of both worlds when you're with us, because you're going to have access to all of this medical equipment and trained people who can do things when they're necessary, but not a second before and not a moment more than what it is that you need to have a great experience. And part of what makes a great experience is your involvement in that process. So you understanding birth, what kinds of things can be offered, what your options are, what helps birth to go well, which things can impede that process, all help us to get where we need to go, which is for you guys to have a great birth experience. So birth plans are really great because they help to guide conversations with providers. So bring it in and bring it to other providers. If you are in our groups where you're seeing like you're in traditional care, so you're seeing a little bit of everybody and you're seeing a different provider, bring your same birth plan in a couple of times with different people and see what they have to say about the things that you've selected, and see if they say like, oh yeah, we do that, or if they don't do that. Or if they're like, oh, I don't know about that, ask the midwives. They're usually the ones that are doing that. So I don't believe that you should have a birth plan to fight against a system. I find that to be kind of twofold. One, I would hope that you don't feel like you need to fight against us, for one. Two, if you bring a birth plan to fight against a system that needed to be fought against is probably so broken that your birth plan will reinforce some of the negative stuff that you'd felt about it. And that's a really awful way to say, but it's just kind of what it is to work in birth work. There are some facilities that are a lot less birth plan friendly, where people might kind of like laugh at the fact that you have a birth plan. Is that a good way to be? Like, definitely not. But we want you to have one because it matters. So you, when you peed on that stick, knew that you were going to Paris in 9 months. Okay. Everybody's going to approach that information differently. Some people are going to download a French app. They're going to get their Duolingo. They're going to read some books. They might read every book. They're going to write out an itinerary of every single thing they're going to want to do and what days are going to be. They're going to do all of those things. Other people are going to be like, cool, and I'm going to show up. And people are like, aren't you going to like learn anything? And people are like, no, like I'm going. So I just, whatever happens, happens. And I think both of those can be pretty fun trips. It's slightly less fun when you are forced to be one of the other ones. But if that's the way that you are approaching your birth, that is okay. What I'll say is that regardless of if you are in this camp or the other camp, you have tour guides, and that's us. We, as your healthcare team, know more about birth than you do, just because we've seen it more. So that doesn't mean that we're like the expert of your birth or of your experience, but we've seen more births. We've been present at more births. So we're going to be able to tell you what kinds of things work. We're going to try to encourage you to do those things, like to roll over, to like try to lift your leg this way. Let me see if I can rub this way. Like, we are here supporting you. We want you to have a really great experience. So I would say, like, we'll get you tickets to the Louvre. We'll let you know the best shows that are coming up. We want you to be supported. So birth plans can be either written or verbal. So you can just kind of have a general idea of the kind of stuff that you want, or you can write one down. It can be in pictures. It could be written out. You can use a downloaded one as a guide. I would usually recommend use that as a rough guide and then print out, like type it up in its own separate form that just has the things that you guys really liked about it. And then know what you're including, what you're not including, and why you're excluding the stuff that you're excluding. There are lots of good options for birth plans, and since I put this list up, there are thousands more. I loved this one 6 years ago when I started doing this class, because it's really pretty, and I think, you know, you can customize the colors, you can put it in your baby book, you can do those kinds of things. Your birth should be an experience. It's something really special, that you are going to get to embark on. So like, don't be afraid to kind of own it and like romanticize it. I had these affirmation cards that I got from Mama Natural. It was a gift, and it helped me so much in just kind of like connecting with my baby, visualizing like my body is completely capable of doing this. Like, my baby is growing healthy in my belly. Like, I know how to birth. Like, those kinds of things, they really can help in reducing anxiety. Sometimes it feels like kind of hokey, but don't be afraid to be hokey. This is your experience. If you are laboring at home, your vibe can be whatever it is that feels comfortable for you. So in this example, she's like in this really beautiful birthing tub. She's got the affirmations on the wall, the ball. She's like moving her body around. Do those things, like lean in, do the stuff that really matters for you. I think when I labored at home with my second one, I had a playlist of music. I had my affirmations out. I got into the shower frequently. I changed positions frequently. And then when I felt like I needed to come into the hospital, I came in. Here at the hospital, you can also create a cool space. You can adjust lighting and the temperature in the room. We just ask it not to be too cold because babies don't like it when it's super cold. So if it's close to time of delivery, we might encourage you to kind of crank it up. We have aromatherapy, we have diffusers, and lots of oils to choose from. You can stream music of your choice. There's Wi-Fi, so please feel free to do that. Like I said, we've got the balls and the oils, and we want your partner to be involved. We want you to use all of the good comfort measures, like the movement and stuff, and the eating, drinking, and all of the good stuff. We want you to have all of those things. So now, kind of switching gears, we're going to go into comfort measures. So movement is super important in labor and as your body's preparing for you to have your baby. So I'm going to start to move. whether we want to believe it or not, we humans are animals, right? And we were not meant to lay in a bed while we labored our babies. Just lay there, just flat, don't move, don't do that. Sometimes I'll have people, and every time I see them, I come in the room, they're like this, and I'm like, you got to get up, girl. So we are supposed to move and change positions. So your nurse will be encouraging you to do that. If you have a birth ball or a birthing ball, you don't want to just sit on it, and you don't want to just bounce on it, because the bouncing isn't what does it. You want to use that ball to help to open your pelvis. So that's going to be things like rolling kind of back and forth. That kind of motion will help to tilt the pelvis. You might also do like side motions. So kind of trying to do figure 8. That can definitely help during contractions and stuff too. The nice part about contractions and managing contractions is that your body knows how to do it. Your body will release those good hormones to help you to manage the discomfort. It will encourage you, as you're feeling that time where it's building up, to go find a more comfortable position. So when you're in that motion, it says, okay, let's go find a spot where we can do it. Let's get up, let's move our body around. And then you have a song that your body will release. So that's a lot of the reason why Lamaze doesn't teach like the breathing anymore, because we recognize that your body will make the breathing pattern that it needs. So slowing down breath, movement, you might be like, oh, something like that. And it's beautiful. It's so amazing to get to be there and to support you guys with it. So thank you for having us, getting to witness the miracle that is you. So definitely using a ball like this can help, using those different techniques like I just showed. Also, when you're having contractions, you'll feel a lot of pressure down. So some communities will use a method where you lift the belly. So like as you're having a contraction, it's uncomfortable. They might place their hands on your belly on the bottom and kind of lift up. You might also use something that's called a rebozo. But if you don't have a rebozo and that motion feels good, you can also use a sheet. So you would take a sheet that's open more than this. Somebody might come behind you, and when you're having a contraction, they would lift up and back, and that helps taking some of that pressure off and should not displace your baby or any concerns like that. We also have things including, like I said, the peanut ball, which if you haven't seen, this is what they look like. Our hospital has a bunch of them, and they're different sizes, different, they're not really different shapes because peanuts are shaped like a peanut, but we do have some that are significantly larger if you had longer legs. Peanut balls are really helpful for a lot of different things. So one of those things is if you're having a lot of back labor, you can use your peanut ball to help take pressure off of your back by you being in the bed and you leaning down on the peanut ball like this. So your belly will hang low this way. You are using the peanut ball to help to support you. When you're lying in the bed, peanut balls are great at helping you to prop yourself up. So it might be that you're laying and then the ball is under one of the legs. You might be laying on your side. And we use that peanut ball to help to open your pelvis. We might also put it this other direction, which helps to open it on the back side. So those two motions together are very helpful in helping your baby to come down. So you can use the peanut ball even if you don't have an epidural, but if you do have an epidural, you should definitely have one because it will help open that pelvis and kind of mimic some of the motions that you would have if you were able to move around. So music can be an amazing tool in labor. It might be something that helps to keep you motivated. It might be like You got a lot of hype music if that's what you feel like you need. It might be something that's just really calm, that's playing in the background, you're not putting a lot of energy towards. Those are all beautiful options. So you get to choose. I've seen people do like a little playlist of songs that they were like, okay, I want the baby to be born to one of these songs. So that's always really cute too. So you have lots of options. You also might not want anything at all. Support is very helpful. Physical touch might be exactly what you need. You might need a hand on your back. You might need someone kind of stroking, or what we call effleurage. When you're having a contraction, even like this kind of motion can help your brain to not be so focused on the stimulus that you're having. You may do different positions like we talked about. Having an emotional connection with your birth team, with your partner, if things are going that way, getting those words of affirmation, all of those things can be really, really beneficial in labor. Okay. So now to talk about your options for medications in labor. We have a couple of different routes. IV is usually Stadol and Phenergan as of this writing. As of today, we don't currently have any Stadol due to a concern with Stadol. There's a national shortage of it, so we don't have any. But we have other IV medications. So IV medication has pros and cons. Everything has pros and cons. The pro for your Stadol or for your IV medication is that you can get it quickly. So let's say you get here and you're uncomfortable and you need something right now, we can usually go and get it. Or if you're like, I don't really want anything for labor, and then as things have progressed and you've been admitted and you're like, I do want something for labor. We'll check first to make sure like, hey, you haven't changed a whole bunch, or your baby is getting ready to come out and that's why you're more uncomfortable. And then we can get that medication. When you get it, it goes into your IV, which you already have access port to. It will work really quickly. It makes you feel kind of sleepy, and then it will kind of work until it gets out of your system. So for some people, like, that's perfect. I want to get it. I want to feel better and move on. But it will wear off. Most of the medications we give in labor are ones that don't last for a super long time. And that's to help to protect the baby's airway so that the baby is able to breathe, because IV medications do affect you and they affect the baby. So they can make you sleepy, they can make the baby sleepy. So if it seems like you're going to give birth really close, like really, really soon, like things are changing pretty fast, then we wouldn't recommend that you receive a dose of the IV medication. And that's kind of based on which medication we have available, what the half-life is, and things like that. And sometimes people don't like that feeling of like, I have the IV medicine and I feel very loopy and kind of out of it. Nitrous oxide is laughing gas. It is a medication that reduces anxiety. It is not pain medication, in that it does not change your ability to feel pain. It just takes away the cares about the pain. So with that, it's self-controlled. Your nurse has to put it together. It usually takes about 20 minutes from when you said, I would like the nitrous oxide, to when it's up and moving. There is a mask. You put that mask over your face and then you breathe in. When you breathe in, it will release the medicine into your lungs. You blow out, you breathe in, you blow out. And you have to do that every time you feel like you need it, and for every contraction, which can feel intimidating. Nitrous oxide is great if you are a person who already knows that you don't want to use pain medication, like you want to be present, you've got really good coping skills, like you're pumped, you're ready for it, but you might need something just to kind of take the edge off. You can use it the entire time. You could use it for while you're having a repair. You could use it and then decide, I don't really like this, I want something else. I think sometimes people have unrealistic expectations of what it is. I'm telling you, it's not a pain medicine. So if you are like in a lot of pain, you're not coping very well, and you really want something to make all the pain go away, nitrous oxide is not the one that you want to go to. If you are doing a really good job managing that, like you're feeling good about your labor process, but you're feeling like, I'm getting to that point where I'm going to freak out, like I need a little something to help me with these, then it can help a whole lot with that. The nausea is the biggest side effect with it. So when you're using it, it can make you want to throw up. Throwing up is honestly kind of like a blessing and a curse in labor, because that increased intra-abdominal pressure can help your labor to go a little bit faster. So we like that. But it doesn't feel super great. It makes you feel super gross and vulnerable because you just threw up. It's a full disclosure. I used nitrous oxide with my third child. I had the best time ever. I thought it was wonderful. I would walk around with a tank of nitrous oxide all the time. So we laughed, we sang, we kind of swayed, we did some different stuff. It was great. So I think that nitrous oxide was wonderful, and I've seen it work really well for the right patient. But again, I think sometimes it's harder because people are like, I really need something and I don't know what, and then you get the nitrous and then you're like, okay, this wasn't it. Epidurals are the ones that everybody knows about. There are pros and cons to it as well. Sometimes you get an epidural and people will say it only worked on one side and I didn't have any relief on the other side. That's obviously very discouraging. Sometimes your epidural might feel like it's not helping a whole lot, or you might expect that you're going to get this epidural and you're going to feel nothing. Epidurals help with the sensation of pain. They don't take away the sensation of pressure most of the time. So if you're very close to delivery, an epidural is not going to be the best option because you're going to mostly feel pressure as the baby is coming down. Epidurals are obviously invasive. They have to be placed by an anesthesiologist or a special doctor in the hospital. That's what they do. So it can take an hour from when you say, I would like an epidural, to when you receive one. During that hour, you'll receive IV fluid that will help your body have extra like fluid in the blood and things like that. So when you get the epidural, if your blood pressure drops, which is a potential side effect with the epidural, hopefully your body will respond better to it. So it can drop your blood pressure, which can affect the baby, but usually those effects are very temporary. Okay. It obviously limits mobility. With all of them, like with the IV stuff and with the gas, we don't want you like up and walking around while you're having it, but you can still sit up and adjust and change positions and stuff. But with the epidural, the option of getting up and going to the bathroom or sitting, changing positions like that are almost eliminated. I have helped people with an epidural get into hands and knees position. We can do those kinds of things if we need to do them to help to support you in your labor process. So don't feel like it's absolutely nothing, but you do tend to have that. You would have a catheter because you're not going to be able to feel your bladder to be able to tell if you have to urinate. So obviously there's a lot more that goes into epidurals. But epidurals work great. And if you're in the time where you feel like you need one, get one. I will support you completely. If you have an epidural and you feel like it's not a very effective epidural, we can always call the anesthesiologist again, have them come up and evaluate it and things like that. They also like aren't included, so you'd get a separate bill from the anesthesiologist, which is sometimes important if your insurance plan breaks things up like that. So if you have like Medicaid or TRICARE, usually that's not as much of a concern. If you have any commercial insurance, know that you would get a separate bill for the epidural and it's not included in your package for your birth. So as a practice, we love it when labor starts on its own. We want you to have cervical change. So we know that for first time people, it takes a little bit longer for labor to kick in and things for labor to get moving. So we're not like, it's been too long, it's time for you to have a C-section. We really want to be supportive of that and only use interventions when they're necessary. We like to labor down, so allowing you to wait until you had more of the urge to push. We don't do routine things like episiotomies or instrument deliveries or anything like that. We really care about informed consent. So that means that you know what's going on, that you feel comfortable with it, that we've talked about it ahead of time, and that you know which your alternatives are to that intervention and whatnot. And you can be in any position that you want. You can be in any position that you want. Sometimes people are like, I really want to be in this position. And then we get there and they're like, I don't really like this position. I'm like, that's okay. The most important part is that you tried it. So hopefully you'll like whichever way you give birth. Again, delayed cord clamping, person of your choice would cut the cord. Immediate skin to skin. As soon as that baby comes out, I'm giving that baby right to you. I'm like maybe holding, so like, hey, look at the baby, like, hi, mommy, and then giving you the baby. And then no eyes or thighs. So that's like, we don't weigh the baby within that first hour, unless your baby for some reason had to be taken over to the warmer. The baby will be up against you having that skin to skin from the time they are born until for the first hour. Okay, and that's true about 90% of the time. So things that might affect your birth plan, no flammable items, none. Don't bring any candles. We have flameless candles here, flameless. They are like battery operated on LEDs. If you want that, amazing. We'll make sure that you have access to them. Your support people we talked about, photography, please don't take pictures of people who don't want to be in your pictures. They're happy to support you, but some of us are just not super photogenic and we don't want that. Our hospital also does rooming in. So we don't have a nursery where babies just go to give moms a break. The baby stays in the room with you. And that is kind of where most places in the country are going to. We find that like it improves your bonding and your breastfeeding rates, and it also helps you to feel more self-reliant when you get home. If you were really suffering and you didn't have any support people and you had to get some sleep or something, you can always talk to the staff, and we're always happy to help you with that because we know that those things make a big difference too. And I love this picture because he's like, whoa. But definitely, if your provider feels comfortable with this, take the pictures. Okay. When you present your birth plan to your provider, like I said, be open to discussion. Bring a written one, but not a finalized one. So always bring your draft. And then bring it to the appointments, be like kind of open to revising it if necessary. But hopefully we're gonna, because you've taken this, you know what kind of things are good options, or like not good options, but things that are available. And there might be stuff that I haven't even thought about yet. So like, or I haven't mentioned on here. So definitely bring your stuff. People also will frequently ask, like, what do I need to bring to the hospital? Which feels a bit like a departure from where we're going. But when you come to labor and delivery, if you know that you're staying with us, you can bring your stuff. I always tell people, like, pack like you're going to stay at a hotel for like 3 days. That's usually like an ideal amount because babies usually stay about 36 to 48 hours. If you had a vaginal delivery, you could stay like 72 hours if you had a C-section, but most of the time you're going home kind of that 48 to 72 hour period. If you brought nothing to the hospital, you would have everything that you needed at the hospital. So we will provide you with diapers for the baby, clothes for the baby, wraps for the baby. We'll provide you with all of the over-the-counter things that you might need, pain medications, pads, spray foam, like things like that, Tux pads, pads for your boobs. Like we will provide you with all of the things that you might need. We also have breast pumps available, which is nice. So if you, for some reason, needed to use a breast pump, or you were going to be separated for your baby for a little bit, because maybe the baby needed to go to the nursery for some reason, we do have pumps that you would have access to. So all that said, we would have clothes for you to wear, clothes for your baby, toothbrush, toothpaste, shampoo, combs, all of the things. But if you are like me, I don't want just anybody's little toothbrush. Like I want to have my own toothbrush. Bring those kinds of things. If you pack nothing, bring the things that you are the most particular about. Try not to bring really valuable items or things that could get lost and you would be like devastated if you never found. There's not so much that it's like a security thing. It's more that you're going to be in one room for your labor, delivery, and recovery. And then you'll move over to a completely different room in the postpartum, and just like you were over here, you were over there, you packed stuff in, like trying to remember where all of your stuff is always going to be tricky. So if you're going to bring valuable type things, like I'm thinking like an heirloom or something, like don't bring your heirlooms. If you really need that energy, make sure that you like have a system in place, like this goes into this bag and we move it from here and we have this. Make sure you bring a phone charger. And if you bring like an iPad or like whatever, like have those things, have chargers so that you can have a good time while you're here. Okay. When you present your birth plan to labor and delivery staff, be friendly about it. Don't be like, and this is my plan and I expect it to be followed to a T. Like, it's like, that's not really nice. You can always be fluid. So if they're saying things like, okay, as an example, when I went into labor for the third time, I wanted to use the nitrous oxide, but then they didn't have any tubing readily on hand. And I could have been like, well, this is trash. And I'm leaving, and I was completely devastated. But thankfully they were able to find tubing for me. So try to be flexible. in case there are things that we had hoped for, but we're not able to accommodate. And be your own advocate. So like you should be able to get up and move. Like, if somebody tells you that you can't, I need to know why. Can you have their provider come and talk to me and explain to me why? Discuss with your partner, your doula, and family members to be courteous. Things that we recommend are things like, if you're having concerns to protect patient privacy, please push the button and then we'll come into the room to talk to you. Sometimes partners will like rush out to the nurse's station. If it's an emergency, like please do rush out if it's an emergency, but we're always happy to bring stuff to you. But also, you're not a prisoner. So like if your partner needs to leave the room to ask a question, they're very allowed to do that. We do ask that you not wait in the hallways, again, to protect patient privacy. So if people need to step out for a moment, they need to step all the way out into like away from the patient care area. Oop. My last thing there is, if you want things, ask for things. So if you are on our postpartum side and your pain's not well controlled, I would like something else for pain. Most of the time, especially on postpartum, the things that you want have already been ordered, but they're ordered PRN, which means like as requested. So if you don't request them, then people don't give them to you. So make sure that you're saying, hey, I didn't get my spray. Can I have my spray? Or I need this, or whatever it is that you need, please let them know. Do not suffer, do not be uncomfortable. If your bottom hurts, be like, my bottom hurts, what are my options? And we'll find you something. They have these kits, and I'm sure you guys have seen them, like the Frida Mom kits, that you can bring to the hospital that has a lot of extra stuff in it. I think those are great. If it's the difference between packing this, like packing light and packing the Frida Mom kit, I I think that you would probably be okay keeping the Frida Mom kit at home. And then that way you've got all of your nice stuff there, and then just like get our stuff like super gross. Not that you're going to be gross because this is beautiful and amazing, but have your stuff that you're going to need at home instead of bringing all of that stuff here, because we're going to provide you with the squirt bottles, we're going to provide you with spray and things like that. But again, if you feel like you have a preference on something and you would prefer to use that, do not let me stop you. So sometimes things don't go to plan. You would plan to have like no interventions, and then you needed to have interventions. You didn't want any pain medication, but then you got pain medication. You were trying to labor completely naturally on your own, and then you had to get Pitocin because despite all of the things you were doing, labor didn't progress. You had done all of the things right in labor, but then or during your pregnancy, and then we find out towards the end that your baby was breech. And then you ended up having a C-section instead of having the vaginal birth that you had planned for. All those can be so challenging for sure. And we know how important this experience is. You are not a failure. Your body did not fail you. A lot of times people will kind of have the intervention and then move forward, and sometimes can feel very guilty about whatever intervention that was. So if it's like, I've only wanted to ever have a vaginal birth and I was scared to death that I was going to have a C-section, and then you ended up having a C-section, it can feel like that's the worst possible thing that ever could have happened. But I don't want you to feel that way, because the most important thing is that you birth your baby, however you birthed your baby, and you birthed this baby in the way that this baby needed to be born. So trying to forgive yourself around those things and recognize some of the reasons around why it is. And it's okay to ask questions. It's okay to be like, why did I have to have this C-section? Even if they told you, if you need to hear it again, if you need to have the reinforcement, that's okay. And if you wrote like a really detailed birth plan and you came in there, guns blazing, I'm going to be a super badass, and then you ended up having C-section, no one is laughing at you. We're not judging you. We're not like, ha ha ha, well, see, that's what happened. We really want you to have a good experience, and we want to support you through whatever it is that you need. So birth plans should be fluid, they should be informed, and they should be discussed before you get here. That way there's no surprises, right? Or whatever. Okay, so there is that portion of it. Now I'm going to start the tour portion. I'm going to start us at the elevator, and then I'll walk us over on labor and delivery. I'll show you a room over there and our bed and some of the functionality of that. And then we'll move over to the postpartum side, where I'll try to show you a couple of different rooms and kind of give you a general view of how that goes. Okay. If you get motion sick, please be aware that you might become motion sick during this journey. I'm currently on labor and delivery, but I'm in our physician's lounge, so this will not be a part of your experience here. Okay. I'm not sure if I'm going to have to turn the blur off. I might. I'm currently standing in front of elevator B. See if I can remember how to turn the blur. Background blur off. No reactions. We'll edit this part out. Okay. So I'm currently standing in front of elevator B. B is for baby. That is the elevator that you'll be brought up from the emergency room, and the elevator that support people would need to take up or down to get to our unit. We are on the second floor, and when you get off the second floor, you will see the family waiting area. Oh, you can. So with that, you'll see the family waiting for women infant center. There are chairs here. There's a television. These are your doors you're going to go through. So when you come off of the elevator, you'll see to your right main tower. That's not where you guys are going. You're going to go this way through these doors. You can press the silver button on the wall, or you can just push the door, but it's preferred that you push the button. When you come through this way, you'll see our award from Newsweek. We are very proud of that. And two kinds of sets of doors. To your left is labor and delivery. And to the right, it's patient rooms by numbers. Patient rooms by numbers is your postpartum side, so where you will go after you have the baby. If the baby is still in you and you're in labor, you'll be in labor and delivery. This is more important for your support people. When you come to the door, there is this call button on the wall. You are going to want to press the button and wait for someone to speak to you. If you've been here before, they might just open the door for you. They might also ask you to say who you're with. When you come onto the unit, like I said, you will arrive this way, use the scale to be taken to your room. Our unit has 6 labor and delivery rooms and 1 triage room if you're coming for an unrelated to labor kind of issue, or if we're full in the other rooms, you might use this room. This is our triage space. It's laid out a little bit different. We have our nurses station. And then I'll show you one of our labor rooms. So this is labor and delivery room 3. Most of our rooms are set up very similarly. So I'm in a corner and showing the room. In this room, you see where the baby's warmer is. This is where all of your supplies are here in the room for easy access. The nurse's little station where she'll be working. This is your bed, your support person's bed / couch. And then this is the restroom. With this room, you have a self-flushing toilet, so don't let that scare you. There's also an emergency pull cord if for some reason there's a concern that way. And then here's the shower. As I said, you're very welcome to use the shower during your labor process. But as you can see, it's not huge, but you're very welcome to use it. So I'm going to show you how both of these beds work. I'll start with your partner's bed or your support person's bed. So not all of our rooms have couches, but this is one of the rooms that do. The ones that don't have couches have a reclining chair. When you have this couch set up, it also has the option for a desk. And this lays out into a bed. Now, typically, if you're going to pull a couch into a bed, it comes out this way, but this back cushion lays down. You fold it out like this. And there is the bed. We would provide you with sheets and with pillows and things like that to help you more comfortable. We'll flip this way. You do have a closet here for your items. If you didn't already get the vibe, Jamaica's telling you don't put anything in. Like, just bring your stuff kind of compact. And it's hard because like you have all of these things. Like when you're over here, you don't need your car seat yet. And I would hope that your partner will like go outside, get fresh air, go and do other things. So just bring up what you really feel like you need most. And we will provide you with the rest. If you have a really like beautiful gown that you would like to give birth in, that you had embroidered, that you got on Etsy, like love it. Like you're definitely welcome to bring that. If you wanted to change into that later and wear one of our gowns, we're happy for you to do that as well. So when you're in this room, just the stuff you're going to need before the baby comes out. When you're on the postpartum side, that's when you'll have your baby. So that's a great time. If you want to bring your car seat up, you can do that. If you want to bring up a breast pump, if you want to bring up something, decorate the door, whatever it is that you'd like to do. So definitely, if you bring up all that stuff, you're forgiven. No one's upset with you. Okay. So here is our bed. And it has lots of cool tricks. And I'm not always the world's best at driving the bed. But the bed does go up. So the bed goes up. The head comes up. The feet drop down. And this can even do all of that in a lower position. So it doesn't have to like be all the way up for that. All right. And with the bed up in that position, you might be there and you might be in the seated position or what we call throne. I'm gonna try to take my shoes off so I don't get, I could have shoes in the bed. It would bother me. Okay. But I'm also maybe too short. So you could sit on this, kind of facing out. If you were having a lot of back labor, you might be like this in this position, to help to relieve some of the discomfort and to provide you some support. You might be climbed up on here like this. You might even choose to try to birth in this position where you're kind of dropping down. When I had my third child, I birthed in this position and I felt that that was very helpful. All right. We have those options. We have the squat bar. Which is typically a two-person job, so. With the squat bar, you could use it either to actually squat. So while you're laboring, you could drop into this position and let gravity kind of do some of the work for you. We'll sometimes have you place your feet up on the bar to push like this, or you might do like a tug of war where you're kind of pulling and using that increased intra-abdominal pressure to help bring the baby down. We might have it wrapped around that and you're using your own body weight. So that's that. There are grips on the side, which you can use to help give leverage. We have the option for foot pedals where you just have something to rest your foot on, and they go all the way up into stirrups. So stirrups can be helpful for a couple of different things. One of them is to help hold your leg if you were birthing in this position. So it might do that and then do it on the other side. You might use stirrups when you're laying on your side. And if you're pushing on your side to help to hold your leg, and then you're bringing your leg up and resting it there in between. The final big trick of the bed is that the bottom part comes off. So that bottom part might come off during your delivery. It might come off while you're having an exam done and we were like placing a balloon or something like that. If you're birthing very quickly, typically we would try to keep the bed together if possible. As I am now entering my 9th year as a midwife, is that right? Yes, I'm entering my 9th year. My back has gotten really bad. I used to be like such a hippie. I am still a hippie at heart, but I used to never break the bed down. I would sit kind of to the side of you and we would do all of the things. And I've just physically gotten where I cannot do it. It hurts my back so bad. Birth work is awesome, but it's very physical work, especially because I'll be in here personally, like rubbing your back, helping you get in different positions, doing those things. So like sometimes I leave here and I gotta like soak in a tub and icy hot and all that stuff. So you can give birth and have a beautiful birth experience regardless of what position you are in. But if the best way for you to birth your baby is kind of more like on your back when you're having like your legs back and you're feeling like you're having good purchase and you're feeling really good and supported and all of those things, that's the stuff that matters. I had this moment with a family years and years and years ago when I very first started as a midwife, where this woman's birthing and she's pushing really hard and she's doing all of the things and the baby's just not coming down, but there's no reason to believe the baby's not going to come down. So I said, listen, I think your baby's head is kind of turned funny. Can we get you on to hands and knees? So we helped her roll over. She pushed twice and the baby was born and it was beautiful. And, I'm high-fiving and patting myself on the back and thinking like, God, that was such a great birth. I did a great job. Go me, super midwife. And then later that woman said that like, that was one of the most traumatizing births ever because I made her give birth like an animal. And I completely respect that that was her lived experience. That's never the intention, is for you to feel like an animal. Sometimes on your back isn't the best position. And even though like the birth went really smoothly and all of those other things were good, I want you to feel honored. And I think for me, like the big reflection thing that I took away from that is that it didn't matter that I thought it was good. What matters is that you think it's good. So my hope will be that we will communicate really smoothly together and be able to give you the kind of experience that feels really empowering. So there's that. So that is this unit. And now we're going to go over to our postpartum side. When you are leaving this side, your baby is given a tag, like they have a tag that is placed on their leg, and that will help us to know if the baby gets too close to any of the doors. And should that happen, alarms go off, things go off, we all go and we make sure that no one's trying to take your baby from the unit. Because that tag is there, your baby will go down a different hallway than you will go down. And that's just because it's a little bit easier to get you straight across, and then your baby goes down this other private hallway. That hallway is a secure hallway, like you have to have a badge, so there's not like secret people hidden on that unit. And I'll show you that when we come back. But the hallway you'll go down is this very first one. So that main hallway, hello, that we came through initially. So now we're going through the section that says patient rooms. When you're coming to visit your partner, there's your elevators. You come through the double doors. Instead of going to the left to labor and delivery, you will come to the right where it says patient rooms. The button system is the same, so you still would need to hit that button and have somebody let you in. I have a badge, so we're going to skip through that part. This unit has people who have a lot of different conditions. So some of them are pregnant people that are here because they're having a lot of hyperemesis and they need to be here to get fluids. Some people here are people who had surgery with one of our doctors, so like had a hysterectomy or something like that, and they're just kind of staying overnight for observation. And then it also has people who had their babies. Because of that kind of difference in the type of patients that are here, we have different styles and sizes of rooms. We try to have all of the people who've had a baby have like the baby having rooms, and they will have those, but sometimes those rooms are full. And if those rooms are full, you might end up in one of the other rooms so that you have space. So I'll show you a little bit of all of those. So this is an example of one of the rooms for people who've had like surgery or is pregnant and receiving fluids. I'm going to walk all the way to the end of the room and then I'll do kind of like a swing across. The big takeaway you see in this room, even though I think this room's a pretty decent size, is that you don't have a bed for your support people, and it's pretty limited in space. They don't normally put people this early up the hallway, number-wise. And then here is the bathroom. Now, try to go to one of the rooms for delivered patients if there's one available. Hello. Good, how are you? Hey, good morning, Dr. Mel. I'm good, how are you?
We're not brewing any trouble at all for.
We are trying not to, for sure, yeah, yeah.
How far we can start cause trouble.
Deal,
Right.
deal. All right. And that's Dr. Hill, he's one of our pediatricians. This is one of our delivery rooms. I am almost all the way, let me move this out of the way so then I'll be all the way at this end of the room to give you an idea of size. This is the room I stayed in after I had my baby, so I'm quite partial to it. I'm glad it was open. All right. Here is the bathroom. The shower is a bit bigger, laid out a little different. And here's your bathroom. That's the toilet. The beds on this side do not do as many tricks. They're also a bit more comfortable. They kind of go up and down. That's it that they do. And I think they you can adjust the angle of the head, but they don't, like, the bottom doesn't come off or anything like that. This room has both the option of the recliner chair and a couch, which obviously is a big difference in the other side. And I believe I've not used that particular couch. I think it does slide out. Your nurses will be able to support you in that. You have this little desk. You have lots of places where you can forget that you put something in them and never see it again. Don't recommend. We do have cable. It's like a basic cable package. All of the TVs also have inputs. So if you had like a Chromecast or a Roku or something like that, you could bring that device. It's especially helpful when you're over here. When you're in labor, maybe you're not caring so much about the TV, but when you guys are just kind of hanging out, you might want to get to watch whatever you'd like. I feel like my husband and I watched like Turner Classic Movies or something because nothing else was on, and it was not my favorite. My baby had to stay a little bit longer. So I was pretty stir crazy and ready to go. So this is 261. So very nice room. I'm going to show you a room that I refer to as worst case scenario, which is not very nice, but is true. So this is one of the overflow rooms. I'm standing at the entryway. You can see it's a really big difference from the last room. So like, see how close that recliner is to the bed, and then we're already at the window. So I'm here at the window and I'll do another kind of sweep around. Very good. And then we'll show you the bathroom next. It feels like even the bathroom is small. So this is not one of the rooms that they're going to like prioritize putting any pregnant person in, or like in an ideal situation, you've just had your baby, you're not going to be in this room because we want you to be able to be comfortable and have your guests. Now I showed you that room that has a couch. Some of our rooms don't have couches, but the room is like really big. If you are in one of those, if you have an air mattress that like can plug in and to inflate, please feel free to bring it. I want your partner to be comfortable while they are here visiting with us. We've been like, can we just buy an air mattress? It's like when you work in hospitals, nothing wrong with it, but there's all these rules on rules on rules. So like, you can't just have an air mattress. You have to decide like where it's going to be stored and who's going to maintain it and where these things are. So bring an air mattress. Make a big difference. And now I'm going to show you our nursery, kind of like the back side of that area. We won't go into the nursery proper, just to protect patient privacy in case there's any babies in there. we are coming around this way. So this unit is shaped like a square. The other unit, where you have your baby, that one is shaped like an L. So it kind of has a hallway that goes up and then around. So on this hallway here, kind of dead space, semen hallway, you'll see here's the nursery. And there are no babies. So like if you remember old movies where the babies were in the nursery and people would go and look at the babies in the window, we don't have that anymore. We still have windows. You will receive a bracelet after you have your baby that has like numbers and stuff for security reasons. You have to verify that your baby is your baby so that no babies get switched around or anything. And that's not because that had happened here. It's because we want to make sure your babies are safe, period. But people can come and visit is like you, like people who have the bracelets can come in and spend time. So, you know, if it's your mom and she has the other bracelet, she can come, it's whatever. We do have these public restrooms, which is a little tricky. The doorway for this hallway used to be over one. And so patients who were waiting in the waiting room could get to this restroom and they could like see the babies in the nursery. But since we don't really use the nursery and for safety reasons, they decided that the doors needed to be moved over an extra one. So that's important to remember. If your support people are going to be waiting for you out there, is that there's not a restroom that's out there. So they'll have to go to that button, hit the button and ask to be let back so they can go to the public restroom and then go back out. I just make sure that people know there is a public restroom option, including for your partner, if your partner is going to make a stinky poo or something and you don't want to do it in the room, you don't have to go home. There's a bathroom. You can do that too. So I'm going to now show you the hallway that your baby will come down, kind of on the other side of it. So, like I said, when we move you over after you've delivered, you will go down this main hallway. Your baby will go down this secondary hallway. You'll both meet kind of right here in the middle because this hallway here is parallel to this main hallway where you just came through, and that also like leads to the elevator and stuff. So we've been down that hallway before. We have not been down this hallway. This hallway is secure in that you cannot open the door. So you see it says staff only beyond this point. And if I attempted to open the door, I cannot get through. So only people with a badge are able to get in. So I'm going to badge in. And you'll see that this hallway is not very long at all. On this hallway is the lounge for staff that has a code, the nursery, our clinical supervisor, the pediatrician's call room, a storage room that has a code so nobody could hide in there, and then the OB call room, which is also code protected. And then there are Christmas supplies. All right. And so that concludes our tour. All right. So I want to thank you for taking time out of your day to watch this video. I hope it was informative and fun and all of the good things. If you have questions about this or anything else in your process, please feel free to either schedule with me, or you can send me a message on the Wayne Women's Clinic patient portal, or you can send us a message on the Facebook. General questions I am allowed to answer, and I can't answer any medical questions on the Facebook page. Thank you so much for your time. I'm trying to think if there's anything else that would be really beneficial for you guys to know. When you're presenting things, sometimes this decorum, right? So like things that we do that are like manners and stuff like that. I used to always tell people, bring donuts. You definitely are under no obligation to do anything, to bring anything. Like number one, like we should give you stuff. Like you are the reason why we're here, and we absolutely love getting to take care of you. It is the greatest honor of my life, of all of our lives. Like we are all here because we absolutely love what we do. You owe us nothing, but if you remember us and you think of us in those kinds of ways, and you think about like sending us a card, sending us like your birth announcement with like your baby on it. If you wanted to like thank people by bringing them donuts, you wanted to send us, you want to do that stuff, it's always appreciated and accepted, but it is in no way required. So thank you guys for trusting us to take care of you. I hope you all have an amazing day. I know you're going to have an amazing birth. Please reach out if you have any questions. All right. Thank you.